health and fitness expert. Hi, I'm Andrea Schneider, health and fitness expert, and I'm with my good friend Karen. Karen, introduce yourself, please.
Hey, Karen Langston here, Healthy Gut Advisor.
So today we're talking about how to make a treatment choice. So if you get diagnosed with a disease or illness, it's scary, especially depending what it is. Cancer, anything is scary and frightening, and maybe we want to cry or be upset, or we're just so emotionally charged up. So today we want to talk about how to make a treatment decision, a choice, because we have to make choices. And sometimes our doctors or healthcare professionals aren't really giving us that much guidance. So my story, 9 years ago, I was diagnosed with breast cancer, very early stage. And it was kind of a gray area, something called DCIS. And what's interesting is about 60,000 American women per year are diagnosed with that. And so it's not advanced cancer, which is a good thing, but it's early stage, and yet the treatment choices are still pretty harsh. So what we want to go through today is basically how to help you, give you some guidance on how to make a choice, whether it's cancer or some other illness. How do you weigh out what to do, especially if your doctor isn't really guiding you? So I, as the attorney in me, like to do like a yellow sheet. I know Karen's laughing there. And I have very nice handwriting, as most of you know, and this is actually my best printing, so you can't really see it that well, but see a little bit. But I also have a PDF that I'm creating with this, and so some of you, you'll get it as well. But basically what I like to do is say, okay, treatment choices. These are the Western medicine type choices, and list them out. So say it's cancer, say it's specifically breast cancer or DCIS in particular. So there's different choices that are going to apply, and there aren't that many choices. So I write them all down: lumpectomy, radiation, chemotherapy, mastectomy, tamoxifen, aromatase inhibitors. And if you don't know what all these are, got to do your research, or the do nothing. And then there's also more holistic approaches, increase supplements, especially vitamin D, antioxidants, fish oil, decrease your stress, increase your exercise, decrease your fat on your body, increase your sleep. So those are just a few things, but mostly I want to concentrate today on how to make a Western medicine decision, because all those holistic things you really should be doing anyway for any time in your life. So then what I do is I do a plus and a minus, and the minus being what are the side effects. So when I was researching this 9 years ago, how to make a decision, I was shocked when I got diagnosed with early stage breast cancer that my treatment choices were mastectomy, which I basically thought when I got diagnosed, oh, they'll tell me to take a pill or something for 6 weeks and I'll be good. So that was totally shocking. Lumpectomy I could have done, radiation. And when I first read about radiation, I thought, that doesn't sound too bad. But when I started talking to ladies who had it, it was sounding pretty rough. And I know some of you have experienced that. So I look at the positive. So what's going to happen if I do this treatment? What are the good things that could happen? Oh, I could be cancer-free. I could feel great again. I could be no symptoms. What are the negatives? So lumpectomy, a negative side effect is you had surgery. You can have infection. Radiation, what are the negatives with that? You could have skin peels, you could get infections, you could get lymphedema. So you need to kind of go through these. I'm not going to go through each of them. You need to do your own research of what the pluses and the minuses are. And of course, you got to figure out and think about the physical plus the emotional side effects. So if you know that you will just be so devastated if you have a mastectomy that you just feel like you couldn't live another day if that happened to you, then that probably wouldn't be the treatment choice for you. But what I also want you to be thinking about is the risk of recurrence. So you have to weigh out the benefit and the negative, and you have to compare that to the risk of recurrence. So especially, and I'm most well-versed with breast cancer. So if you were diagnosed, you want to talk to your oncologist, and they should be able to give you percentages that you could fill in here and say, based on my particular breast cancer or whatever illness it is you have, if I were to do this treatment choice, what is my risk of recurrence? And they should be able to give you a percent based on you. And so I weighed that out, and I actually re-looked at my own book the other day to see what my percentages are. Here's my book that I wrote, You Are Not Alone, Life After a Breast Cancer Diagnosis. Wrote it, took me 4 years to write this book. It was published about 5 years ago. And so I went over again my risk factors. And it was interesting because at first the oncologist gave me a certain set of risk factors and then changed it after talking to the radiologist. So what is your risk of recurrence? And then most importantly, or very importantly, is what is my chance of survival? So if I have a lumpectomy, my risk of recurrence is X percent. What's my chance of survival beyond 5 years, beyond 10 years? And you should be able to get percents. You need to really push the oncologist and your doctors for these numbers. So to me, this really helped me make a decision. So I laid it out on paper. I went back and forth and ultimately came up with the decision that was best for me. And I call it the sleep at night factor. You want to be able to sleep. So whatever you choose is great for you, but you have to feel comfortable with it. So just because I chose to have mastectomies, I'm not telling you that that's right for you. There were a lot of variables and factors that went along with my decision. But I think this can really help you. And I know some of you really struggle with this, and it's causing you a lot of anxiety and depression, and you're sad, and you don't know what to do. So this is what I did. I had to be very objective. I call this being objective, like thinking about like if my friend Karen here came to me or a client or a friend, how could I help them make a decision in an objective way, kind of taking the mental component out, at least for this portion of the decision. So Karen, what do you have to say about this?
Well, I just had a couple of questions. In your book, do you know the list that you just made? Is that in your book?
You know, it's not like a PDF like this. I mean, it's not laid out like a chart. And
Sure.
so I went through and I listed like how I made a choice, how to make treatment choices. So page 216 to 224 kind of gives guidance of how to do it. And then, but this was the actual methodology of how I did it.
Okay. Well, that's extremely helpful. What do you say to those who, I mean, you are definitely a lawyer, so, and lawyers are just very black and white. They've got everything all listed out. I'm thinking about somebody like me who's just, I'm chaotic. I mean, the only thing that's, I can't think of the word right now, and I used to say this all the time. The only thing that's the same about me all the time is the fact that I never do the same thing twice. And I can't think of the proper word right now, which is funny. But what about somebody like me who isn't going to make a list? Really just emotionally distraught, let's say. I mean, because, you know, when we're told that we have breast cancer, we're told that it's basically a death sentence, which is so not true in the alternative world, but in the medical world, unfortunately, that is the case. So what do you do with somebody who's just, I mean, you shut down, you're all of a sudden you're told you've got breast cancer, you're being told that, you know, this is a death sentence, that we've got to annihilate and attack. So how do you help somebody who just literally just wants to throw the covers over their head? How do you help them cope?
Well, for one, they have to help themselves. I mean, we can only do so much with people. And so you know that. And so one, I'd like to think that it's not a death sentence for starters. And it really depends what stage you are. Unfortunately, I just had a lady friend who did die of breast cancer, but she let it go so far without doing anything about it that was just horrible. And so people sometimes will ask me, like, and a lady just asked me the other day, why are we seeing so many more cases of breast cancer? And it's not necessarily that there's more, it's just that people are getting detected earlier and they're going and having testing and they're finding it. So it's there, it's been there. But yeah, the first instinct might be to just get in bed and crawl into the fetal position and throw the cover over your head. But the reality is at some point you need to make a decision. So this is a method that worked for me and I've used with other women who it's worked very well for. You know, it's not a one size fits all in terms of treatment choice or how to make a decision. So if whoever is watching this has a better way to make a decision, I mean, I guess you could throw, you know, darts at a board and say, hey, which decision should I make? But I'd like to think there's some logical something going on. And, you know, if you just absolutely won't make a list, I mean, talk it out with someone. And I talked it out with my mother, like continuously, even though I had my list, I went back and forth. And unfortunately, I had 4 months between my diagnosis and when I actually got my treatment. And that was the worst 4 months of my life, the stress and the mood and the, you know, upset and anxiety and the sadness. So it's normal to go back and forth with the decision, but ultimately you need to make a decision. Now, maybe you go to various doctors or health people, and maybe some of them will give better guidance of how to do this, or maybe you need to go to a psychologist, a best friend, a mother, a sister, girlfriends, and just talk it through. You have to be able to make a decision that's comfortable for you. So what I'd advise is you don't put your head in the sand. You don't just say, oh, I can't make any decision, so I'm not going to do anything. You need to do something. So does that help at all, Karen?
Yeah, no, absolutely, and it's interesting because you touched on one thing, a couple of things actually there, but one of them is my grandmother passed away of breast cancer, but like you said, she did absolutely nothing. She apparently had this weird skin thing like for years on her breast, but she never told anybody, and I don't know if it started seeping or what, but at that point, it was the point of no return.
Yeah.
And so you are right. I mean, you're faced with something and you do have to do something about it, for sure. So it's okay if you want to pull the covers over your head for the first day when you're diagnosed. That makes complete sense because it's denial mode, it's anger, it's fear, it's everything. But you're right, you do have to act on something. And I also believe too that when we take action, it helps us to get better as well. It helps us feel like we're in control because at that point you do feel out of control. And I just think that the whole process, whether you do an integrative approach or a natural approach or a complete oncology medical approach, at least if you've got an understanding of what you're going through, there's empowerment in that and that you take your power back.
Exactly, and I totally agree with you because that's kind of the thing too. You might sometimes feel like your body has defeated you or you're upset with yourself because you feel like your body has failed you when you get a diagnosis or that you did something wrong or, why is this happening to me? And I think those are all natural reactions, but at some point you need to take action. And I know you could be in a state of overwhelm, especially when you're diagnosed, especially when you hear the word cancer. I mean, part of you just shuts off and it's a very difficult time. And so I've been in those shoes and I remember how that felt. And I actually was rereading some notes in my book and I had kind of forgotten because over the years I've gotten focused on the physical aspects and I forgot so much about how the mental component was so strong at that beginning when you're just not even sure if you're going to survive. And even though mine was early stage, I still felt like maybe I'm not going to live. And I had an 18-month-old baby and a 9.5-year-old daughter. So I kind of went into survival mode. And in all honesty, like a friend had asked me after she reviewed my book, is there an emotional component to it? Well, I kind of pushed the emotional component aside for a long, long time. And that's something I've been working on in the past couple of years because I was so focused on why did this happen? What can I do about it? How do I go, get better and all that stuff that I didn't necessarily face the emotional elements that went with it, even though I was sad and upset and all that. So,
well, and there's two parts to that, Andrea, too. I mean, I've worked in healing centers in Canada as well as Mexico, and I've worked for health centers here in the United States. And if there's one thing that I've noticed is that people either come to work with me on the emotional level or they come to me on the physical level. It's usually not both. So when they come to me on the physical level, they don't even know that there's an emotional component. But the ones who are on the emotional level know that this is an emotional component, and they really feel that if they deal with the emotions, then everything else will fall into place. And that's very true. So you were at a point in your life where you didn't know there was an emotional component, and there's nothing wrong with that. Let's just deal with the physical. But you also had that empowerment to take control and want to live. So
right.
that's huge.
Right. And so I have to say, for the first several years during and after my diagnosis, I was in the physical aspect. And then it was about 4 or 5 years ago that I realized more that there was the mental component as well. And that's where the integration of the mood and the decreasing the stress and all of that and the things that I wind up teaching in my course because they're things I needed to learn for myself. So yeah, it's really important. And sometimes when you're going through the process, it's hard to see it all. It's hard to see the big picture. And it's easier now. I'm 9 years out, thankfully. And I realized in looking at my own book, 1 more year, and that means after 10 years, I should hopefully never have breast cancer again. I'll be
that's right. Yeah.
after I hit the 10-year mark. So,
but you did something really important though, and I hope that we'll touch a little bit more on this, is not only did you do what you did on the medical side, but you also changed all of the triggers that led to that diagnosis. And we were talking about this earlier, but I just really believe that anybody who's diagnosed with anything, and I've had a couple of my own diagnoses, is that it's a gift, and that gift is basically your body saying, "That's it. You are now putting me first because you have ignored me for long enough, and now you need to put me first, and you need to work on me and get me better." And so that's what you did. Now, you weren't ready for the emotional side, and that's fine, but you knew enough. But then afterwards, as you did more of your research, you realized, okay, I got myself into this situation. How do I stop it from coming back? And so you looked at all aspects of your lifestyle and environment.
You're exactly right, Karen. And I know it's hard to face sometimes, especially when you're in the midst of it. And you're just so caught up, and especially if you're going to all the doctor's appointments and all that, and it takes over so much of your life. But when you have time to reflect, and that's what I've been working on in the past couple of years, and that's what I bring to others, is it's time to really do put yourself first, like Karen just mentioned. And we take care of everyone else, the family, the kids, the neighbors, the this one, the that one. And sometimes we forget about ourselves. And this may be hard to hear or to think about, but if you do, I think you'll agree with us that as women, that's just kind of how we've been raised, and that's a cultural thing, and it's just a natural thing. But you have to think about yourself. So you've got to decrease that stress. You've got to increase the mood. You've got to increase the exercise. So you may go and you may do these treatment choices that I mentioned, and I do believe in a combination of the Western medicine, but also what I call the holistic or other more touchy-feely type things like we're talking about. Yeah, touchy-feely. But it's about self-care and self-preservation. So even if you did all of the Western medicine things, but you changed nothing in your life, I'm not going to tell you you're going to get a recurrence, because I don't want you to be thinking that. But you'd have a much better chance of not getting a recurrence if you start focusing on taking care of yourself. Would you agree with that, Karen?
Oh my gosh, yeah, absolutely. And the thing is think about it. Okay, you've been diagnosed with breast cancer, whichever type it is, and then you get yourself to a point of wellness or it's in remission. Why wouldn't it come back if you don't change anything? Because it was the things that you did. And when I say that it was the things that you did, I'm not saying that you maliciously did these. A lot of it you just don't know about. I mean, the personal care products, the household cleaners that are endocrine disruptors, the xenoestrogens, the BPA in our water, in our plastics, and that kind of thing. So you didn't even know that this was happening to you. So you have to look at all aspects. And that was what you were talking about with your list. It would be nice if you added that part to the list as well, as, okay, what can I change in my home environment? How can I change my food so that I'm not taking in these xenoestrogens, these endocrine type disruptors? And that might be a new word for some of your viewers, Andrea, but that would be something that they do afterwards. And just going back to that whole overwhelm, right now you've got to deal with the breast cancer, and so you deal with that. But then once you're in remission, or even while you're going through the process, take one thing. Okay, as soon as I finish this bottle of shampoo, I am going to start buying a more natural shampoo that is not causing my hormones to become unbalanced. So yeah, just different aspects of it.
Right, I totally agree with you, Karen. So today we just gave you some pointers, things to do, how to make some decisions, things to be thinking of your life. I know that's a lot to take in. If you make a few changes at a time and we've helped you in any way, then I'm really happy that we did this video for you. So you could connect with us. Best way for me is www.mybestme.us. Then you could contact me through there. I teach a course that covers on how we can basically be the best us. And Karen, I know, teaches a course. Hers is mostly on gut health, which is so extremely important. Watch for our other videos, our blogs, our courses, and we hope we've brought some value to you. So again, I'm Andrea Schneider, and this is Karen. Karen, give us how to find you.
Hey, Andrea, I just wanted to say one more thing just before we cut this. I have literally worked with women from stage 1 cancer right up to stage 4 cancer in my integrative institutions that I've worked for. So I just want to make it clear that I don't actually personally work with people with breast cancer. I would rather them have come and work with you. But I have seen women with stage 4 cancer come into these clinics and do an integrative approach. So they've done the chemotherapy as well as the nutrients to support the body, to support the chemo, and I've watched them go into complete remission. And my favorite patient in the whole world, she came down to the institution where I was working in Mexico. It's an integrative institution. She came in on her private jet. Her breast cancer was so bad, she was beyond stage 4, that we had to rush her to another hospital, and they had to remove her breast. I mean, the cancer was literally oozing out of her breast. Now, at that stage, if she had gone to a regular hospital, let's say, they probably would have said, there's nothing we can do for you. So she probably spent about a month in that regular hospital. Then she came back to us, and 6 months later, there was no cancer, completely healed from this cancer. So it doesn't matter what stage you're at. If there's one thing we can leave you with, is please get the doom and gloom out of your head. Get the negative part of the seriousness, I guess, of the breast cancer. I'm not saying that it's not serious, because it is, but just know that there's different ways to treat breast cancer, and that it's not a diagnosis for death. It's a diagnosis of take care of yourself. That's what it really comes down to.
And I agree with you, Karen, and that's a good point too, and you made that a few minutes ago, is that sure, we don't want to get diagnosed with something, but if you've got it going on in your body, you want to get diagnosed. I mean, no one wants to have cancer, but if you have it, it's a good thing to find out about it. And then you got to take action. And so it's the combination maybe of the Western medicine, but the changes in your life and your lifestyle that will give you the best chance of a thriving, successful, happy life that isn't lived in fear and anxiety of when is the other shoe going to drop and when am I going to get cancer again? I'm just so scared. And I see that with a lot of women, that they're just so afraid. So we want to get past that scared and not taking action to the other side of fear, and more joy and happiness and knowing that you're going to be fine.
So your program can help with this, Andrea?
Right. So I've got the 6-week program that we cover mood, stress, overall health, eating, sleep, exercise. To me, those are the 6 main components of how to live a happier, healthier life.
That's great. So you know what? That's the first thing they can do, is just get your program and get started.
That's right. And that's the key, is getting started. So, and it's just integrating a little bit at a time. You don't have to do it all today or tomorrow. It's doing a little bit at a time. So we'll make some great choices in your life, make some little changes, and I hope that I can help you be the best you. All right, take care, and thanks for watching us. Bye, Karen.
Bye.